welcome back to my channel. And for those of you, this is your first time, I welcome you. My name is Katia, and thank you for being interested in taking this nursing journey with me. So at the bottom, you guys can hit the like and subscribe button, leave any comments. All comments are welcome. So today I wanted to tell you guys about my nursing clinicals at the hospital. So the hospital that we're at is it's a trauma center. I think level 2 trauma center. And the unit that my clinical rotation goes to is the med-surg oncology floor. So each of us is given one patient that we're responsible for the entire day. We do 11-hour shifts from 6:30 a.m., 6:30 to 5:30. So when we're assigning our patients in the morning, we connect with the overnight nurse, and she gives us our reports, pretty much why the patient came in, what medication have they taken, what medications are they expected to take, is there any testing that needs to be done, whether it be diagnostic testing or even like urinalysis, and just anything that needs to be done for the nurses that's coming on board. So as far as we are concerned as the nursing students, this is the beginning of fundamentals for us. So we're only allowed to do bed baths, vital signs, head to toe assessments, and pretty much do what the PCAs or CNAs would do as of right now. I think in a couple of weeks we'll be learning about administering medications and IV lines, and then we'll sign off and get the okay to do that. But before you can do anything, you have to get the sign off by a professor of what you're able to do from what you've learned in the classroom. So this is going to be my third week going to the hospital. So right now, as I said, we're only been signed off to do head to toe assessments, bed bath, gout, which is helping the patient stand up, walk around, give them a little mobility if they need assistance to, if they're allowed to, if the doctor's giving orders to have them, be a little more mobile if they're not self-sufficient. And it's an amazing journey. So although we're assigned to one specific patient, because with that specific patient, although we are allowed to do vital signs, we do all of that, but we also have to create care plans for the day for that patient, as well as write our nurses' notes. So, but after that, in between time, we're allowed to help other patients that's on that floor, because, each nurse is assigned to maybe between 5 and 7 patients for their day. So after I've gotten my patient settled, I would normally ask, hey, can I help the PCAs or anyone take vital signs? And I think the PCAs, they give them ice water twice a day on their shifts. So we would do stuff like that. And for me, what I like to do, once everything has been settled and slowed down, patients have been given medications, I like to sit down with my nurse and pick her brain a little bit. Like, ask her how she write her nurse's notes. I like to ask them, how do they create their care plans? And, if there's anything that needs to be done, if she has to draw blood, if a patient has to do like a chest x-ray or something that's, bedside, I always ask, is it okay if I watch? I'm not allowed to do anything, but I do like to watch because I'm a visual learner. So although I'm not doing it, I'm taking note in my mind. When it's time for that, I already have a little gist of what I'm doing. But other than that, as nurses only get, I think, about 30 minutes breaks, but as the students, they give us an hour, which we take from maybe 1 to 2 most times. But other than that, the hospital has, the past 3 weeks, it has been busy, but it's been fun. It does help time go by fast, especially when, like this past Tuesday we went, all the beds were full on our floor. So after I got my patient settled, I helped the PCAs do a vital signs on all the patients. I helped a couple patients do their bed bath that wasn't self-sufficient or mobile, where they couldn't go to the restroom and bathe themselves. So I helped do that. But sometimes you and your nurse, is multiple students assigned to one nurse. this past Tuesday, because we go every Tuesday, this past Tuesday, I was lucky enough to be the only student assigned to my nurse. So I was able to get a lot of one-on-one time with her. I was able to pick her brains a lot. And she actually picked my brains as well. Like, okay, this patient, I had a patient who had a really high blood pressure. Like, it was 210 over like 103. And I was like, whoa. And I took it over 3 times, and I used 2 different pumps because I'm like, this can't be right. But the patient, he was very anxious. There was a language barrier, so we were, using translator, and I think that kind of made his blood pressure go up, and we had to call the doctor and like, hey, this is your patient. This is his blood pressure. What do you want us to do next? And once we end up having to test his glucose level. So once we did that, we gave the doctor the results. He ordered some medication for the patient to take, and about 45 minutes later, we followed up and checked his blood pressure again, and it did come down. So for me, this is where pharmacology is very important, and you're learning about the different medications. You're learning what would bring blood pressures down, what would cause the blood pressure to go up, because for his situation, he had came in because he overdosed. And so you just can't let certain medications mix, and you have to know your beta blockers, your receptors, and all of that. So what I would like to do is, in the hospital, we're not allowed to use our phones. The hospital is a no cell phone zone. So I wish I could, record me walking into the hospital, maybe give you a glimpse of the floor, but, patient confidentiality is #1 priority. So we want to make sure we're on the right side of the law as nurses. As a nurse, there's certain rules and guidelines that you have to abide by. There's certain regulations that you just cannot cross, and I just want you guys to know that I think I did tell you guys that next week I'm taking my finals, and I'll keep you guys updated. And that following Monday is when we start our nursing process 2, which is the second half to fundamentals. Nursing fundamentals, and that's when we'll be starting doing the injections, IVs. So we do that on campus. So I'll be able to record that for you guys and give you guys a glimpse of how our sign-offs look like, and the whole process of, I believe, the first 2 weeks of every course, you're learning your skills in a clinical simulation setting. And then after that, once you get the sign off, you get the sign off to go to the hospital and actually, perform get these skills hands-on in the hospital. But I didn't do it last time because I didn't ask my professor for permission. But this time I will ask, do you mind if I can record, the process of learning our skills in clinical settings. But I'm so excited, you guys, so excited. So this Tuesday is actually going to be our last day at the hospital. This Tuesday is going to be our last day at this particular hospital for nursing process 1, and I believe we're going to another hospital for process 2 from what the instructor told us. But I'm so excited, and I just appreciate all of you that takes the time to watch my videos, listen to my story, follow my journey, leave comments. Trust me, I read them as soon as they come in. It is greatly appreciated, and I just want you guys to know that I am feeling the love. I am feeling all the love that you guys are sending my way. So like I said, leave a comment below if you have any questions, if you have any advice, tips that I should follow. I am free and I am open to any and everything. If there's something that you want to know that I should record, any suggestions of what type of videos that I should make, please comment below and I will read, and I will definitely take up your advice and try to answer whatever I can, or do as much as I can to keep you guys on this journey with me. Bye.